is a WJZ special, Baltimore Standing Together, searching for solutions to the opioid epidemic. Now, here's WJZ's Vic Carter and Denise Koch.
Hello, everyone, and welcome to Baltimore Standing Together. This is the second in a series of town halls presented by WJZ, the Baltimore Sun, and the University of Baltimore Schaefer Center of Public Policy. The next hour, we will be looking for ways to address the opioid epidemic. Addiction and overdoses are happening on an epic scale. Thousands of families torn apart. Most of us know what the problems are, but finding the solutions is the real challenge. We're so honored to have with us here today. Joining us right now for today's town hall, we have with us Dr. Lena Nguyen. She is the Baltimore City Health Commissioner. Thank you for joining us. Harford County Sheriff Jeffrey Gaylor, whose county has been hit particularly hard by the opioid epidemic. Pastor Craig McLaughlin of the Mount Zion United Methodist Church, and Edgar Wiggins of the group Baltimore Crisis Response. Joining us in the audience now, my co-anchor, Denise Koch.
Thank you, Vic. Well, as we look for solutions to the state's and the nation's #1 social crisis, we have gathered together with us today in the audience health professionals, legal experts, law enforcement, most importantly, individuals and families who have faced the opioid epidemic and taken it to heart. We also have people here with us today who are dedicating their lives to helping those who are suffering from the disease of addiction. We sent a team of reporters out to investigate this issue, and what we learned is that drugs that can be a vital service when you are in pain can also be horribly addictive and can lead to a downward spiral that will take with it families and entire communities. So hopefully over the next hour we together will tackle this problem and find some solutions so that we can move ahead and do something to this crippling crisis that's taken over our state.
Denise, thank you. So how did we get here? WJZ investigator Mike Elgren shows us how widespread this problem is and how difficult it is to understand.
My son's name?
The opioid epidemic is ravaging America, from powerful addictive painkillers to heroin, claiming 175 lives nationwide each day.
The pandemic is devastating the very fiber of this country.
Maryland is one of the top 5 states for opioid overdose deaths, a staggering toll. 1,500 people died in just the first 6 months of last year.
We see about 1,000 people a day who need treatment, and it's far less than what the actual need is.
Can you hear me?
5 people a day are dying from opioid overdose. That's shocking. If that was any other disease, it would be, on everybody's lips.
Any corner you go to, you can get the heroin. People, are overdosing left and right, like it's no big deal.
While heroin is a major problem, powerful synthetic opioids like fentanyl and carfentanil are leading to a surge in deaths. You can see just how little of each substance it takes to kill.
The size of a grain of salt would be enough to cause an overdose and take your life.
In hard-hit Harford County, a deputy even became ill after being exposed to fentanyl on the job.
I started sweating profusely. My face started burning.
Put your hands up now!
As part of Harford's war on opioids, an elite task force is targeting the supply chain.
This is a packet with gel caps.
Track it down to the dealers.
It was a crisis.
The governor has declared a state of emergency. Some counties have even sued manufacturers of addictive opioid painkillers. Anne Arundel County, which has also been hit hard with the 3rd highest number of deaths in the state, launched the Safe Stations program, where anyone with an addiction problem can go to any fire station and get help.
Welcome back, brother.
In Baltimore City, health officials have made Narcan, which can revive those who've overdosed, widely accessible, and partnered with hospitals to help addicts.
Addiction has to be treated like a disease. No hospital would ever say we don't treat patients with cancer.
The crisis has not peaked yet, and the cost in lives is so high, leaders can't afford to stop fighting.
So, seeing that reminds us just how bad this problem is. We're going to ask our panel here today to answer these questions. Where do we go from here? What are the solutions? Dr. Nguyen.
We have to first recognize that treating addiction as a crime is just inhumane and unscientific and not effective. So here in Baltimore City, we focus first and foremost on saving lives. if someone is dying right now, we have to save their life in order for there to be a better tomorrow. And so we've made naloxone, or Narcan, which is the opioid antidote, widely available. I issued a standing order, which is a blanket prescription for naloxone, to every single one of our 620,000 residents in Baltimore. And in the last 2 years, everyday residents have saved nearly 2,000 lives. And we're partnering with so many others in our state, in the city, including our fire department, so that we can target these hot spots of where fentanyl is, and then we can connect people directly into treatment.
Sheriff Kaler.
I certainly agree that we're facing something that we have never seen. We've seen previous opioid epidemics in our country's history. And in Harford County, we've taken a unique approach in that we're still going to do our law enforcement job. We're responsible for law enforcement corrections, and we aggressively target the dealers. But we're also working with so many community members, our county government, our county executive, and just true members of the community to say, what else can we do? And a lot of the kind of out-of-the-box thinking, Narcan, again, throughout our community, throughout our office, throughout the detention system, inmates as they get released, Vivitrol at the jail. So many different concepts as our awareness effort goes forward. That's not your traditional public safety approach. Is the way we're also combating it, in addition to still doing our law enforcement and targeting the dealers, because those are the people that are costing so many lives.
Okay, thank you. Of course, this is a very personal thing for you. Pastor McLaughlin, tell us your story.
4 years ago, my daughter Hannah, 19 years old, died of a fentanyl overdose. She had been a heroin addict for 4 to 5 years before that. My passion, we know what makes persons vulnerable to addiction: trauma, anxiety disorder, ADHD. What do those vulnerabilities look like while the child is still 8, 9, 10 years old? There was a raging sea under the calm surface of our daughter. I didn't even know it.
Wow.
But we can learn what it looks like when they're young. Okay. That's my passion.
I'm sure. Mr. Wiggins.
Well, Standing Together, I think, is the perfect title for this meeting, because from where I sit, it's not just about behavioral health organizations like mine. I mean, we provide crisis services to people with behavioral health conditions. But what has really become important as we move forward are collaborative efforts with, for instance, the Baltimore Police Department. We have a program called LEAD, Law Enforcement Assisted Diversion, where the police identify and try to divert people who are found being engaged in low-level drug crimes to get them involved in treatment. Our crisis response team program, which teams a specially trained clinician with specially trained police officers who respond to behavioral health calls for service. Our work with the faith community. So this panel is an excellent example of what we need to combat this terrible problem.
Well, so many issues to address here. Denise?
Well, thank you, Vic. I'm here with Clay Stamp, who is the Executive Director of the Opioid Operational Command Center, which is a statewide agency, my understanding is, and it's new. It's only about a year old. And you are trying to see statewide how this problem is impacting.
Yes, Denise. As you know, the governor declared a state of emergency because truly we do have a crisis that's affecting families and separating communities all over our state and, frankly, our nation. This is probably the worst crisis that many of us have ever witnessed, like we would with any other crisis, to facilitate communications, to drive programs in a balanced effort in the areas of prevention, enforcement, and expanding access to treatment and recovery services, because it takes all three. And at the end of the day, it's going to be a comprehensive prevention program to change our culture to remove the demand away from the supply that is hitting our streets today.
So we have people from all different avenues, so they contact you if they want to find out information?
So the state's role is to empower local jurisdictions to do what they do best, and that is make a difference in their community. The other thing we're doing is creating a sharing platform, so best practices. For example, the Baltimore LEAD program, the Law Enforcement Assisted Diversion program, we're spreading that to other jurisdictions. We're spreading, sharing best practices, if you will. So it's an all-hands-on-deck approach. We're all in it, and the people you see in this room, they're all a part of an army of people that care. And it's going to take an army of people to do the hard work, to put our nose to the grindstone, to continue to do the hard work in this crisis, because every life matters, and it's about saving lives.
All right. Good phrase. I like that phrase. Thank you, Clay.
While fighting the opioid epidemic day and night, an elite Harford County task force is gaining international recognition for its progressive approach to helping addicts while gaining the intel it needs to take down the dealers. WJZ was given rare access to the front lines of this fight.
Put your hands up now!
Dramatic moments on Baltimore City streets. WJZ cameras on the front lines with Harford County's elite opioid task force as they move in on a suspected drug dealer.
Out of the car! Out of the car! Out of the car! Go down.
Once in custody, officers search the suspect's house.
Please search warrant! Got you. Please search warrant! Police! Search warrant!
This squad is made up of the best. Officers with specialized training and full federal authority to cross city, county, and state lines to go wherever they need to get some of the most dangerous criminals off the streets.
Our main objective is to do what we did tonight, is to track it down to the dealers that are providing the heroin and fentanyl to our citizens up in Harford County, especially the ones that have lost their lives.
Captain Lee Dunbar and his unit work day and night in a never-ending battle against the opioid epidemic sweeping Maryland and the country.
We're here in the city, miles away from Harford County. Why here? What happens here that affects you?
Well, what happens here, this is where the vast majority of our heroin and fentanyl is coming from. The majority of our citizens that are suffering from this opioid addiction are coming down here to the city on a daily basis.
WJZ gets rare access, spending 2 nights with the task force. In addition to the bust in Baltimore City, our cameras capture one along I-95 in Harford County. Traffic stops like this are the backbone of major investigations into the ever-growing problem of opioids on our streets. In this case, a vehicle goes into Baltimore City. A deal is apparently made, and drugs are brought back here to the streets of Harford County.
In plain view, this is a packet with gel caps.
This is death right here. This could kill someone.
And depending on the user, maybe even partial of one of those capsules could kill them.
For many of these officers, this is a personal mission. Almost everyone on the task force has been touched by the opioid epidemic.
My family has not been immune from it either. We have guys where it's hitting very, very close to home in our agency, and it becomes personal for us because we're responding out to every one of these overdoses.
These officers are gaining international attention for their aggressive, innovative approach.
We want to send a message up in Harford County. You're dealing drugs to our citizens. You're killing our citizens with the drugs you're putting in their hands down here. We will come down here and lock you up and prosecute it to the full extent of the law.
Sheriff Gaylor, these are your guys out there every day. We had the, of course, pleasure of going out with them and having them show us exactly what they're dealing with on a day-to-day basis. Were you prepared for this?
I don't know if prepared is the right word. We certainly knew coming into office a couple of years ago that we had to deal with this, and we had to deal with it head on. We haven't tried to hide from it at all, but one of the tactical approaches from the law enforcement stand that we took was certainly different in that we began sending out a drug investigator. One of Captain Dunbar's people, we have a task force up in our county that's a conglomeration of not only sheriff's office but our municipal, state, and federal partners. We began sending a drug investigator out on every scene so we could figure out who was selling and who was responsible for taking so many lives. And because of the task force concept, our partnership with our state and federal partners, it allows us to chase those dealers wherever they think they're going to hide and bring them to justice. And I couldn't say enough good about the task force and the work that men and women do there.
Now, we've seen that this is a model for programs, and people around the country and around the world are looking at the way you're doing things. Tell us about that. Where have people been sharing some interest in your program?
Oh, it's from across the state, from across the country, and yes, indeed worldwide. We've done pieces in Captain Dunbar from France and from England. Again, holding people accountable. And there's two perspectives to it that some individuals use to support their habit, and then there's those that we know that they have dealt with that are in it purely profit-driven. And those are the ones that we really want to target, and we want to put in front of the judicial system to ensure that they are seeing maximum time and maximum sentences for the lives that they are responsible for taking out of no more than greed. You know, so they do a great job. And again, their efforts are being looked at and modeled around the country and worldwide because this is a worldwide epidemic.
Okay. Denise?
Yes, Vic. Knows no boundaries, knows no demographic. I am with Captain Dunbar, who you just saw in that piece that Vic did. And you talk about it being very personal, so I can imagine that that gives you an extra drive to get out there every night. But what about what Dr. Wen said, that this is a medical crisis? How would you respond to that?
Sure, it absolutely is a medical crisis. Like the sheriff said, we team up with our local health department there on a national level with HIDA as well. When we respond out to these overdoses, our main function is the enforcement to target the dealer, not the individual that's suffering from addiction. Each one of my detectives have a help card. We provide them a help card first so they can get help with their addiction, but we also need to find out who those dealers are, track that back to those drug trafficking organizations, which unfortunately is coming back to Baltimore City. About 70% of our fatalities and overdoses in general are coming back to the streets in Baltimore, and that's our objective, is to target the dealers, target the drug trafficking organization, get them off the street, charge them to the fullest extent of the law. We're treating them as crime scenes, especially our fatalities, such as a murder. We're going to our federal prosecutors, our state prosecutors, Mr. Castley, his deputy state's attorney, Dave Ryden, who's prosecuted some of these cases for us, and charging individuals, indicting them on second-degree murder and manslaughter charges. These are the actual dealers. These are the people out there making millions of dollars out there in the streets. So we're not targeting the addict. We're trying to get them help, but at the same time getting valuable intelligence so we can target the drug trafficking organizations.
All right. Thank you for what is obviously very good work that you're doing.
Absolutely.
Thank you, Dick.
Thank you, Denise. Organizations across the city are trying to shoulder some of the responsibility to stop this epidemic. Joy Burnett has the stories of two men in two separate stages of drug addiction and how a nonprofit called the Baltimore Station is trying to help.
The effects of Baltimore's drug epidemic are present at all hours. A visual cue could trigger a relapse. That's what happened to Michael Rosenthal.
I bought some drugs from someone, which I thought was supposed to be heroin anyway. But come to find out, when I woke up in the ICU at Johns Hopkins, come to find out there was fentanyl in my system.
He woke up a different man.
The muscles died because the circulation was cut off. They tried to save my leg at first, but it was beyond saving, so they had to amputate.
Each year, the Baltimore Station provides housing and drug addiction counseling for hundreds of men like Rosenthal. And there's one man who's going out onto the streets in search for addicts.
It's just unfortunate.
James Hardy's personal story prepared him for this role.
I started using marijuana back in '72. And it manifested, you know, from marijuana to drinking to pills.
In less than 40 minutes, James spots a man who says he's currently hooked on synthetic marijuana, a chemically altered substance that could lead to death.
Can I pull over and talk to you?
James' task is now to rescue the 28-year-old before his drug addiction leads him down the same path.
How often are you using?
Every day.
What's your worst fear?
Dying. I don't want my mother burying me or my sister burying me.
We're going to do something about it to help you. All right?
Yes, sir. Thank you.
You got my word on that.
All right.
A young man's desire for change may save his life.
Is this kind of a last resort for a lot of people?
It is, yeah. And so when men come to our program, they've usually hit rock bottom. And like I said, they've really burned a lot of their bridges, but do realize that they want to get into a program that is going to get them the help that they need.
Well, I'm standing here with James Hardy, who, as you heard, is in recovery and has been doing this phenomenal work for 28 years. Is this the worst it's ever been right now?
Yes, it has. Been very bad. When I first started using it, wasn't this bad. Now more people are dying, and there's not a whole lot of help for them.
So what is the key to getting someone to agree to treatment? How do you talk them into getting to that place?
First of all, I get them to trust me. You know, and I let them know my story, that there is help out there for an individual. And once I gain that trust, I do the work that I need to do to get them in. And I just keep calling them. I keep reaching out to them until they decide they want to give in and try to help themselves.
You know, we hear a lot that it's really hard to kick these opiates, that it's tough, that people go to rehab multiple times.
Yes, they do, but you can win. You can't stop. You just got to keep going and going. You know, there's plenty of programs around that can help you, but if you don't have the will and the drive, then you ain't going to get the work, and then nobody's going to help you.
Thank you, James, for the work you do. Thank you. Dick.
Thank you. Mr. Wiggins, you deal with this every day. Tell us more.
Well, we deal with it every day. We have a full range of behavioral health crisis services that include addictions treatment. But I think what's important, and was an excellent example by the last speaker, is the importance of people, peers in recovery. One of the things that we've added to our staff are peer support specialists. The thing about peers is that they demonstrate through their daily process of living that recovery is a process. You're not going to go in and get cured and everything's going to be hunky-dory. You're going to be in recovery for the rest of your life, and that's what peers demonstrate. We have one peer with our LEAD program who single-handedly has rescued 6 people, okay, with naloxone, who he just saw passing out on the street. I mean, think about that. And he came in and said, you know what I did today? And I'm like, no, I rescued somebody. And I mean, it's that level of commitment, I think, and that's what's important.
All right, thank you. Denise?
Well, I'm here with Pastor Derek DeWitt from the First Mount Calvary Baptist Church, and I've heard Narcan has a street name of Jesus Juice, and I understand that your church, that you are training your parishioners on how to hand out Narcan. Is that right?
Yes, we're training the parishioners and other churches as well. We're inviting other pastors to come in and to learn, because we're seeing this every day, and sometimes even on Sunday when we walk out of church, we encounter people who have overdosed, and with the other programs that we're running, soup kitchens and food programs, we have people who come in, and unfortunately we witness and see this every day. So we thought it prudent to be able to help and to revive some of these people, because as Dr. Wynn said, the first thing is to save the life. And then we know that we have faith-based institutions that have programs that have succeeded, drug rehab programs that have succeeded, and we try to get the word out so that we can collaborate with federal and local agencies and the foundations to be able to duplicate our efforts and save more lives and get more people in and out of treatment.
Saving lives. Well, Narcan is important for that. So are fentanyl strips that allow users to test the heroin before they inject it. And there is one mother from Carroll County who knows that firsthand and uses those tools. And she knows that treatment doesn't always work. Her son went to rehab 7 times in 5 years before he overdosed and died.
I remember just hearing the screaming, and I couldn't, at first I couldn't focus on who it was, and then I heard it was me.
This is the last photo Gina DiMaria has of her son, taken 3 weeks before he died of an overdose at 22. Anthony was a good kid, a state champion motocross rider, but when he broke his femur in an accident, doctors prescribed OxyContin and Percocet for the pain.
So things
he became addicted.
Back then is nobody should have pain. Nobody should have pain, especially kids.
Needing to feed his addiction, he later told his mother opioid pills were too expensive.
Someone had introduced him then to a $10 baggie, and it did the exact same thing.
His last rehab 5 years ago was going well, and then
I believe he met up with some people, and they had heroin, and he used that one last time. It takes everything from you. And then it takes your life.
I would imagine that the hardest thing is wondering what your son might have become.
And I miss him terribly.
Gina has turned her heartbreak into action, working up to 90 hours a week to save the lives of other addicts. She hands out Narcan and test strips for deadly fentanyl.
Right now, it is so out of control that we've got to try to keep them alive.
It's that basic.
It's that basic. We've got to keep them alive, because if we keep them alive, there's a hope for recovery. If they're dead, there's no hope for recovery.
And Gina, story I have heard again and again of somebody who is taking the pain pills for a legitimate reason. They have an injury, they have a surgery, and then before they know it, they're hooked.
Yes.
And that's what happened with your son.
Yes, it is. He became injured. He broke his femur, and at that time the mindset was no pain. They didn't want any. He was only 15 years old at the time, and they didn't want him to have any pain.
And tell us what you do now with Anthony's Way.
With Anthony's Way, I do a lot we do outreach on the street. We have tried to change our way of approaching people because of the ever-changing drug, fentanyl. There's been a time where I noticed that there were a lot of people not calling us because of trying to get into detox, and I started talking and asking people, and the reason is they're dying. The heroin a year ago isn't the heroin today. One-time use, they can die. So we try to give out. We've given out an enormous amount of strips. They're expensive, but we try to give as many as we can out, and it's not going to stop them from using, but it's going to keep them alive.
And your son did go to rehab. He tried.
He tried. He went to rehab 7 times. And it was just, it doesn't make sense. I mean, that's why I believe wholeheartedly it's a disease, because of the constant drug seeking. And that's what he did. He constantly was drug seeking.
Well, you've made an admission.
Yeah. Thank you.
Right. Thank you, Gina.
Well, certainly this is a story, and all of these stories resonate with you, Pastor McLaughlin. Tell us a little bit more about your circumstance with your daughter.
Completely shocking. If you knew my daughter a week before she went into middle school, and then you knew her 2 months later, you would think this was 2 different people. There was an explosion. Like I said earlier, there was kind of a raging sea under that calm surface. But I think maybe the hormones of adolescence and middle school kind of released that storm. And just, one thing I tell parents is all your critical decisions you've got to make right at the start. Once they get very far down the road, the impact of decisions you make has less and less power. And yet that's when you don't know anything. You're not educated, you're not equipped. So that's what it felt like. She just started moving faster and faster. It was 1,000 miles an hour very quick.
How long did you live with this issue? How long was the process?
She started smoking marijuana, drinking age 12, kind of hiding that from us. We didn't really know it at first. She took a pill at age 14, age 15, right in between there. It was 0 to 1,000 miles an hour right at that time and took off. She died when she was 19, almost 20. She was in 21 different institutions, between rehabs, detoxes, psychiatric units, juvenile detention.
This is only over a 6-year period, 5 or 6 year period, right?
Right.
Okay.
It's amazing.
Had to test your faith.
Yeah, exactly. Something they say, parents, you didn't create it, you can't control it, you can't cure it. And then you wonder about God. Where's God in all this? And what I would say is God is right there with you, and God is right there with your loved one who's struggling. He never leaves them.
All right. Thank you so much. Well, we're going to turn now to Denise in the audience with another interview. Denise.
Thank you, Vic. I'm with Dr. Gregory Branch, who is the health director of Baltimore County. We've heard about Anne Arundel County. We've heard about Harford County. So what are you seeing in your county, and what are you doing to fight it?
Unfortunately, we're seeing the same thing. So many lives lost. And so we have a philosophy in Baltimore County that we have to meet people where they are. We ask our peer recovery specialists to go out on the street, go check them out. It's our reach team. They're there for caring, connecting, communicating with the people so that we can make a difference in their lives. It's also very important to educate everyone about Narcan. I believe in second chances, third chances, fourth chances, how many chances they need. That's extraordinarily important. One of the other things that we focus on in Baltimore County is educating our providers. We have a PDR, prescribing drugs responsibly, and we try to teach our providers what's the best way to do that so a lot of this does not start. I can tell everyone, if you have any questions or any concerns and you're in Baltimore County, call us, 410-88-REACH.
Where would you like to see Narcan? There are people calling for it to be in the schools.
We have it in the middle schools and in the high schools. Very, very important. We have nurses in all of our schools. We know that we even had a 9th grader who overdosed in our school.
Yikes.
However, we were able to save that life because we had Narcan in the school. That was another chance. This is real, and it's a matter of life and death.
Boy.
On behalf of WJZ-TV, the Baltimore Sun, and the University of Baltimore Schaefer School of Public Policy, thank you so much for joining us. And let's keep talking.
Thank you for watching a WJZ special, Baltimore Standing Together, searching for solutions to the opioid epidemic, presented by Healthcare Access Maryland.